Hey guys, how you doing? Today I wanted to talk quickly about Bernie Sanders' video, which was out on March 28th. Um, Only 16,000 views, unfortunately. Don't know why. Only has 400,000 subscribers. I don't know why. We're all so busy talking about things that don't really matter, like the LGBTQFXYZ stuff. I don't care about your pronouns. Stop telling me your pronouns. I don't care. No one should be using them. We know how to use pronouns. We do not require your input to use pronouns to describe you. Okay? So the argument's done. I buried it right there. That's all you need to hear. Let's stop that. Let's talk about things that matter, like Medicare for all, like reproductive rights for men. Okay? Let's talk about these things because they matter. And one thing here, you know what? I think Biden blows. Okay? I think Trump blows too. I just think they're both bad. I think Biden's a little worse, but I think Trump's still not that great. What has he done for us? What was his focus before? The wall, keeping the illegals out. We use them to do the low end jobs. They're very useful. They're very good. They even do their own businesses. They pay taxes. Let's not worry about the borders, like the Mexicans are going to come kill us or something. Please. Let's stop worrying about pronouns. Who cares? Let's think about you know what? People say that the mainstream media, I don't care whether you watch Fox News or CNN or MSNBC, they're all designed to well, you can make the argument that they're designed to make you care about things that don't matter, right? They don't want you to face things that do matter. Like my boy Sanders here is pumping out stuff trying to get the conversation going on Medicare for all. Why do we have police and fire and some public schooling for kids paid for by taxes, but we don't have the main thing we need? We're the last developed country that doesn't have universal health care. People are dying left and right. This is what we need to talk about. This is what we need to change. We need to push for this change. If America could fix their healthcare issue, if we had universal healthcare, and if we had um, if child support was made opt-in only, then this country would be fixed, in my opinion. Yeah, we can have a conversation about basic income. It's not as important. What we need to work on is Medicare for all and some reproductive rights for men, and we'd be we'd be in good shape. So let's watch this real quick. It's not too long, and thanks for sticking with me here, guys.
We are all aware of the enormous crises facing our country and the world. We see the horrific war and suffering in Ukraine. We're more than aware of what the scientists are telling us about climate change and the existential challenge that it poses to the planet. We are mindful of the current pandemic, which has already taken almost 1 million lives in our country, and the likelihood of future pandemics. We are outraged by the massive level of income and wealth inequality in America, the fact that half of our people live paycheck to paycheck and struggle every day to provide for their families at exactly the same time as the very wealthiest people in this country become richer.
Yeah, I'm not sure how to resolve that. I do support higher. I do support higher wage, increased wage, minimum wage. Sorry, I still haven't got used to a camera yet. Got to give you time. Um, so the arguments here for that are, hey, if someone can't afford to run their business, not going to run the business anymore, not going to have the business anymore. Well, that's fine. There's going to be someone who comes around and they will create the same business and they'll find a way to do it better and perhaps cheaper and be able to pay the people more, right? Or just be able to accept less money, but they'll still make a profit. So the argument about, hey, it's hard for businesses, well, then the business need to do something differently. Because if a person's working full time, they should be able to afford the basics of getting by. That's what needs to happen. And yeah. And if you have to pay for medical expenses, which can be thousands and thousands of dollars. Did you know that when you get a bill from the hospital, that if you ask them to itemize it, it'll be cheaper because they throw a bunch of BS. They just blow smoke up the butt. They just throw some. They just inflate it a bit at their own whim, right? Because they're assuming a health insurance place, a medical insurance place, is going to grab it and pay it, right? It's insane. It's criminal.
And we move toward an oligarchic form of society. And in the midst of all of that, Donald Trump and his allies are moving aggressively to undermine the very foundations of American democracy. But in the midst of all of that, and that's a whole lot, it is imperative that we not lose sight of the healthcare crisis which exists in our country.
Which is what I was saying before. A lot of things are being talked about on the main. You guys, you should not watch mainstream media. Stop watching Fox. Stop watching CNN. Stop watching MSNBC. Stop watching all of these things, because they're doing nothing but rotting your brain, getting you to think how they think. They'll give you some news, but they'll spin it the way they want you to take it. They'll have conversation. They'll put the good, like Fox News, putting all the hot chicks on there, like, oh, they make you want to agree with them about what they're talking about. Want you to take their side in it. If you actually thought logically and reasonably, you wouldn't have all the views they have. You wouldn't. If you thought logically and reasonably, you would not be right wing, and you would not be left wing. You'd be where I am. I'm in the middle. I'm moderate. Okay. I think the LGBT stuff can go away. Done with it. But I'll take their Medicare for all idea. Right wing. Nothing wrong with the border. I have a gun, but I don't believe in a billion of them. I don't think we need big guns, but whatever. I can do without their religion. I think religion needs to die out. So, I'm not right wing. I'm not left wing. I use my brain, and I'm in the middle. And if you use your brain too, you would be as well.
And what that means to ordinary Americans. Today, the United States remains the only major country on earth not to guarantee
That is
healthcare for
sad.
all people is a human right.
Why is that?
The result of that is that over 80 million Americans are uninsured or underinsured with large deductibles and copayments.
I lived in California for like 10 years. I just moved back. I was in Downtown Beach for 5 years. I was in downtown Los Angeles for 5 years. And the deductible over there is insane. It's like, why do I have health insurance? I have health insurance if I get hit by a truck. Pretty much is the only reason. And I'm in the hospital bed for like months. That's the only time it's really going to get used. The deductible is so high. Where I currently work, deductible's way high too. I might as well be in California, actually. It's disgusting. I mean, if I pay for insurance, they should pay for everything.
In America today, we spend far more per capita on healthcare than any other nation, almost $11,000 per person.
We would pay less if we had a universal health care program. We would pay less money.
While at the same time, some 60,000 Americans die every single year because they lack insurance and are unable to get to a doctor on time. In America today, we pay by far the highest prices in the world for prescription drugs. In some cases, as much as 10 times higher for the same exact drug as sold in Canada or in Europe.
What they do here in America is, if they have a patent on it, if only they can make it, they jack up the price way up, so make you pay like through the butt. Like, just, hey, you want to... It's how they make their money. It shouldn't be. With no regulations, that's what they can do. I mean, what happened with the Great Depression back then? Anybody, raise your hand if you know what happened. Why? Because there were no regulations. What happened? Why did we recover after the Great Depression? We put regulations in place, right? That's called democratic socialism. You know that word the right-wingers hate, socialism? That's what helped us after the Great Depression. Okay, nothing to do with socialism. Does not mean communism. They are just protections put in place for the people. That's what the banks needed. They didn't have that. They went haywire, and it screwed over the American people. 2008, what happened? Banks didn't have the regulations anymore. It screwed over the American people, right? But did we put anything in place to stop that? Probably not much.
The result of that is that 1 out of 5 patients in our country are unable to fill the prescriptions their doctors prescribe, and many become unnecessarily sicker and sometimes even die.
It's almost as if the insurance companies don't want you to do preventive care and they just want you to get really sick so you pay a lot of money. No.
as a result of not getting the medicine they need. In America today, we have a major shortage of doctors, nurses, and other healthcare professionals.
Yeah. We do. And we need more. And we need ones that, and I've heard this argument before about how, well, if they switch to universal health care, they'll pay them less and they don't want to be doctors or nurses so much, blah blah blah. But when that happens, what we'll do is we'll have people who want to help people be in those professions, and that's why they'll be there, and that'll be higher health care for everybody.
The result, in many parts of this country, especially rural areas, it is increasingly difficult for people to receive the medical attention they need in a timely manner. Meanwhile, in the midst of this doctor and nurse shortage, young people are leaving medical school and nursing school hundreds of thousands of dollars.
Yeah, that's not right.
In debt. Dental care in this country is outrageously expensive, and millions of Americans, including many seniors, do not get the dental care they desperately need. A significant number of dentists do not accept Medicaid payment, which means that lower-income Americans cannot get to see a dentist, even when they're in pain. At a time when over 100,000 Americans died last year as a result of drug overdoses, it is clear that we are looking at the worst mental health crisis.
A lot of people who die of drug overdose, well, a good portion of them, I'm sure, they would receive prescriptions for whatever ails them, right? And that prescription run out, or they can't fulfill future ones, or maybe they shouldn't have, but they were told they couldn't. Anyways, they couldn't get more. So what do? They turn to street drugs to try to alleviate the pain or whatever they're going through, because they don't have the proper health care. So they overdose it because they don't know what they're doing, because they're their own medical person. So they die or become a drug addict and their life goes down the drain.
In the history of our country, and we have barely begun to address it. And these are just some of the crises facing our dysfunctional healthcare system.
Yep.
In my view, and I have said this for years,
Yes, you have.
healthcare is a human right,
Yes.
not a privilege.
I'm tired of the right-wingers being like, it's not a right, as if that's an argument to end all discussion. I've seen that. I was living in Redondo Beach, and I went down to Hermosa Beach Pier. I was going down there, and they had some sort of thing going on out there, and I was talking to some old dude, and he's like, it's not a right, as we live in a society here in the country where we have a population that needs to be cared for, right? We have fire and police and stuff to care for them, to make sure they're okay. You don't need to pay any money for a police officer to come and help you or shoot you, or a fire to come put out your thing, because it's in our taxes. I'd rather pay a little more in taxes than die and have people around me die that I care about. If you don't think it's the right, it should be right. And I've never heard any good argument to not have it that way.
Simply stated, that means that every man, woman, and child in our country should be able to receive the best possible medical care available,
Yes.
regardless of
Regardless.
That means that when you're sick or you're in need of an annual checkup,
Yes.
you should be able to walk into the doctor's office of your choice and get the care you need.
Because with preventive care, that means less money paid, and will be able to help you before it becomes a major issue. If you're here in this country, we want you to be healthy. That's what the attitude should be.
No forms to fill out, no deductibles, no co-payments, no bureaucracy, just you and your medical provider. There should also be a much greater emphasis on...
Oh, yes. And how many people die because the insurance company doesn't want to pay for something, but the medical place knows that needs to be done, but the insurance drags their feet for months, or decides no.
On disease prevention, keeping us healthy rather than just treating us when we're sick. Let us be very clear. None of this will happen so long as our healthcare system is controlled by private insurance companies. That is
Preach it.
The simple truth.
Yep.
The function of private insurance is not to provide quality care
Nope.
for all, but to make as much money
As much
they can
money.
for stockholders,
Yes.
and to pay their CEOs outrageous compensation
Correct.
packages. That is why we need to move to a Medicare for all single-payer program.
Yes.
But as I think you understand, taking on the giant insurance companies, their lobbyists, their apologists in Congress, and the fear-mongering we face from the corporate media will not be easy.
A lot of fear mongering. They'll tell you, oh, there's going to be so much wait time, and they'll decide there'll be like a death panel. Have you heard that before? That's a pretty stupid thing to say. It's all fear mongering. How many other countries have universal health care? All the developed countries do, except us. Yeah, sure, it's not perfect, but it's a heck of a lot better than we have now. I'd rather go there now, do what we need to do, and try to fix things as we go along than just get stuck here.
Just as one example, the pharmaceutical industry itself, just the drug companies, spent some $300 million in lobbying to make sure that Congress did not lower the outrageous cost of prescription drugs in this country. They had over 1,500 paid lobbyists on their payroll, 3 lobbyists for every member of Congress to protect their interests.
So they can jack up the prices because they're allowed to, because there's no restrictions, and there should be.
And that's,
like I said, democratic socialism. That's what we need to protect the people. It's not communism. They're protections for the people.
just the pharmaceutical industry. But the good news is, despite all of that, is that in recent years, more and more Americans have come to understand that the current healthcare system does not work for them.
Not enough people.
Fundamentally changed.
You guys need to help.
In which millions of workers lost their employee-based healthcare through no fault of their own.
This is what we should be paying attention to.
Of the current system.
This is what we need to be rallying for.
And the increased support we are seeing for Medicare for All is coming not only from healthcare consumers, not only from ordinary people, but is coming from doctors and nurses and healthcare professionals all across the board. These healthcare practitioners want to be able to practice in a system that is designed to protect human health, not protect corporate profits.
Right. So if you have an insurance company that only cares about profit, they're not going to care about the person, which is why they drag their feet all the time and let you suffer and let you die.
This Tuesday, my progressive colleagues in the House will be holding a hearing on Medicare for All.
I wonder how that
and
went.
I applaud them for doing that. In early May, as chairman of the Budget Committee, I will be holding a similar hearing, and we will be discussing on the committee the findings of the Congressional Budget Office, which determined that Medicare for All would not only
Not enough people are talking about this or pushing for this.
but would save the healthcare system in our country hundreds of billions of dollars.
Is it because it's not as juicy as getting in people's face? I mean, you guys know me. I love to get in people's face. I've debated, you've seen my videos, I debated people left and right for a long time. Is it because it's not as juicy? I mean, we need to have a conversation among the dinner table with people we know. We need to comment on this. It needs to be discussed. We need to make this, we need to push for the mindset of the country to realize that we need to do this. This is what needs to happen. If enough people talk about this and acknowledge this, then this place will be much better off. Just like right now, since the Roe versus Wade, what it did to open the discussion for men's reproductive rights, now we're talking about men's reproductive rights more. We didn't before. If that punch to Roe versus Wade didn't happen, then we wouldn't be having this conversation. I hope that one day that Roe versus Wade gets put back, and because I'm support abortion, but I'm actually glad that it happened, because we can now have this conversation about, what about men's rights? What can we do to help to make it so men don't have to pay for a child they never wanted because the woman never got consent to have a baby with his sperm? Why aren't we talking about that? Why is a woman able to choose when to be a parent and men can't? Right? But now we're starting to have the conversation. I see Pearly things online talking about it. I really like what she's doing with that, and I've seen other people as well. I've been thinking and talking about that for years, but I haven't really put it online so much. But now that I see it, it's very refreshing. But we need to talk about this. We need to push for this. This is very important. This is just as important.
This struggle for a healthcare system that guarantees care to all will no doubt be difficult. We are taking on some of the most powerful special interests in the world. But it is a struggle that must be fought, and together it is a struggle that we will win. Thank you very much.
Yeah, I'll leave that little end screen there for you guys. Please feel free to check out his website. Have a conversation with somebody. If you don't want to pass around my video here, pass around his. I'll put it in the description, whatever you want. Just pass it around, post it in your Facebook, put a little something in your You know, how about this? If you post my video and I get enough views on this, um, you know, I'll talk more about it and I'll, you know, I'll have discussions about it, maybe a debate about it with somebody. I can find someone to have one with. Um, just put it in your Facebook, put it in your Twitter, you know, whatever you can. We need people to be aware of things that. Why isn't the mainstream media talking about this? Why isn't the mainstream media discussing Medicare for all? Because they don't want you to be concentrated on that. They talk about the things they want you to be upset about. They want you to be upset about Mexicans coming from the border or the LGBTQ XYZ stuff going on. They want you to quarrel about that. They want to tell you what to care about. Stop watching them. Stop caring what they. You want to know what I watch, what I read? I'll tell you what I do. Not only do I use Reddit because it's a good place for people to come and talk about things. I hate that it's controlled by the leftist. I've been banned many times off Reddit because of my views on some things, my moderate views. But overall, you can usually find pretty decent content on there. But what I do is I subscribe to a 1440 Daily Digest. It's like a morning news thing you'll get in. I'm not. They're not paying me. This is something I actually do. 1440 Daily Digest. I can put a link into it in the description here. A sign up link. It gives you basically a rundown of daily news without the bias, without Fox News hot chicks telling you what you should or shouldn't believe, or CNN or MSNBC trying to get you upset about something that's not real or something. You know, it's you start from there. Try to find stuff that's not tainted with telling you how to think. Just giving you the information. That's what you want. So yeah, just have a conversation with someone about this. You know, let's make this something that we talk about because it matters more than I would say. I would say it matters the most right now. I think reproductive rights for men is like second, because that's half the population right there, and men are. Sorry, I just pet my cat, so my nose is itchy for some reason. Um, that's half the population who you know, who are being destroyed by mean to pay for something they never wanted. You know, and then we can talk about the Pound Me Too movement and how that's destroying lives too with unfounded allegations and stuff. So men are having pretty bad. So that's next, and so that should be covered as well. But I would say Medicare for all and men's rights are probably the two biggest things that we need to conquer in this country right now. I'd say those two things. Yeah, I challenge. Like, if anyone thinks otherwise, if anyone thinks that there should be more than that or something other, please tell me down in the comments. But my vote would be those two things: universal health care and men's rights need coverage right now more than anything else. All right, guys. Thanks for listening. Peace. Logic. What is it like this? Like this? I forget what I did.